Well, it has been a huge week when it comes to the fight against Alzheimer's and other forms of dementia. At an international conference, advocates and researchers learned more about a possible new blood test, a promising new drug, and how people in more rural communities like Greater Minnesota are seeing higher rates of the disease. But as KARE 11's Carla Holt shares, perhaps the most dramatic news came from a technology that isn't new, a study into how simple hearing aids can help those facing the disease.
When it comes to hearing experts,
As soon as I got my PhD,
Dr. Dave Fabry ranks as one of the best.
continued that at Mayo.
Which means when this chief innovation officer at Starkey Hearing Technologies set his alarm to hear about a study,
That I live streamed it at 2 a.m. when I was in Charlotte.
you know it's a big deal. But why?
How is this unique from what we have been hearing, pun intended, hearing about for really years?
That's such a great question. Difference with this is it's the first large-scale prospective study that looked at and followed a large group, almost 1,000 patients who all met study requirements of having a hearing loss.
In other words, Dr. Fabry says this is the first time researchers have established not just correlation, but causation between hearing loss and cognitive decline. For 3 years, researchers followed 1,000 older adults, all experiencing hearing loss. Notably, hearing aids did not appear to reduce cognitive decline within the overall group. But Dr. Fabry says they saw dramatically different results when it came to a subgroup experiencing cardiovascular disease, which is associated with dementia.
So we had this unfortunate Bermuda Triangle of strong comorbidity.
In that group, Dr. Fabry says hearing aids slowed cognitive decline by 48%. And that, this doctor says, translates to hope.
When they start to lose hearing, they stop participating in family events, social gatherings, engagement. That leads to loneliness, depression, isolation, and certainly we've seen correlations with a cognitive decline. That if you have a hearing loss and you have been diagnosed with diabetes or hypertension, have that conversation with your audiologist, with your ENT, with your primary care doctor.
And on that point, as an Alzheimer's daughter who herself has experienced hearing loss, I couldn't resist asking this expert one more question.
You know, those of us with that direct connection to this honestly cruel disease, we want to do what's right.
I would encourage you to stay on top of it, monitor your hearing, and continue having that conversation. The worst thing is to be silent about this.
Well, fascinating. Dr. Fabry told Carla 94% of those who participated in the study reported they were extremely or very satisfied with the benefits of those hearing aids. They also reported that hearing aids help loneliness thanks to improved communication. Now, if you're curious about your hearing right now and want to learn more, we have a link on our website at kare11.com.